Well, okay, I'm going to continue from last lecture. So instead of talking about the awareness that's up here in your head, I'm going to talk about human things because I can't keep telling you to go and just be that. You have to have more things for your body mind to do. We're going to talk about mental illness today, and I'm going to tell you the truth. The best experts on mental illness are not psychiatrists. They're not druggists, and they're not a bunch of people at McDonald's having coffee talking about it. The people who have mental illness, are they the experts at it? Perhaps some of them. Some of them, probably not. What kind of mental illness do we want to talk about? Let's just call it mental illness. Why do we call it mental illness? Because the people who we say have mental illness, the psychiatrists say are ill. Because they've got a book, DSM 2 or 3, whatever is that. It's the Diagnostic Statistical Manual, which basically says statistically, if you don't fit within the bell curve of normal, then you're an outlier and you're mentally ill. That is the way that medicine looks at everything. Either you're part of the normal group or you're part of the abnormal group. Moving on. In search of, I don't know why some people are considered to be normal and some people aren't. The psychiatrists are going to say most of them are pill pushers and they're going to say it's a chemical imbalance. That's pretty much what they go with most of the time because that's their reason to be psychiatrists. You go there and they decide pretty much quickly by looking at you, you know, what kind of pills you need because they pretty much judge you based upon, how you present to them. Isn't that what they're supposed to do? No. These people are assholes. These people probably should be locked up because they're criminals, because they are completely out of their league. They don't understand anything at all. Despite having taken whatever courses they've taken, they don't understand shit because they don't know nothing except what they were brainwashed in school to learn. That's what you have with a psychiatrist, a brainwashed person who has got a really big fat ego and they think that they know how to fix other people. Well, they're going to say, well, sometimes when we give people certain pills, they seem to get better. I'm not going to talk about those people. I'm going to talk about all the other people who go to see psychiatrists and don't get any help whatsoever, and in fact feel like they're a burden. The psychiatrists are a burden on them. And the whole world pretty much believes that medical doctors should be the ones you always listen to. This is brainwashing 101. You don't feel well, you go see a doctor. What should happen? Well, if you look at your finger and you've got, looks kind of pussy, what should you do? Well, you should clean out the wound and get some antibiotic. But you can't go and get well, you could get like a a cream or something. But if you feel like you want to have antibiotics, you can't prescribe it to yourself because you're not a medical doctor. At least not in the country that I live in. Some countries, I think you can go to a druggist and say, I want such and such antibiotic. The whole point of the matter is there is an elite group of people who are allowed to prescribe whatever the hell they want, from opium to cocaine analogs called Adderall. It's never going to be my decision to allow people to go to the drugstore and buy something for their what they think is gonorrhea. What difference does it make? Because if you go in to see the doctor and you say, I think I've got gonorrhea, not every doctor is going to actually test you to see if that's what you've got. They're just going to prescribe some replacement for penicillin or amoxicillin or something. How do I know? Because I know everyone knows what doctors do. If they were good doctors, what they would do is they would take a sample of some mucus that you have and send it to a lab and have a lab tech do some tests to see exactly what you've got. But they don't. You all know it. You go in and you say, I've had this green phlegm I've been coughing up. Okay, and the doctor just writes you a prescription. And you try it out, and if it doesn't work, then 2 weeks later you come back and you say, Doc, that didn't work. A good doctor, before he prescribed anything, would test you. Send it to the lab, a sample, and wait for the lab to come back and say exactly what they found. I mean, the huge issue that, every once in a while it comes up, and it's the big elephant in the room, is that we have a problem with running out of useful antibiotics because we overuse antibiotics. Everyone knows the story. Whose fault is it? Multiple people. Doctors prescribing for unknown reasons. My best guess, you don't have a best guess. You are guessing. You are guessing that this is what the problem is, so you write a prescription so you can collect your money and move to the next patient. In other words, these doctors are lazy, incompetent, and technically criminal because they're prescribing for something that they don't know. What do you mean? Well, the Hippocratic Oath, they don't really follow that, is do no harm. But they might be harming you by prescribing you lithium for your mental disease. I knew someone who was prescribed lithium. It ruined her kidneys and she had to go on dialysis for the rest of her life. That was a psychiatrist. But, in essence, what you're doing, if you are a doctor and you're prescribing something because you're guessing that the person has got a bacterial infection, you haven't used any of your book learning. You're not acting like a professional. You're acting like a rank amateur. And that's what they do. So, most of their licenses should be pulled as far as being medical doctors because they're incompetent. And that's a criminal thing. What do you mean? It's administering a noxious substance. That is the criminal term for giving something to someone that doesn't belong in their system. And antibiotics don't belong in your system. They don't. But someone is saying, take this. Because I'm guessing. And I'm a medical doctor, so that is not good enough. It is criminal to give someone a noxious substance. And that's what antibiotics are. What about if you were to go to Mexico and, go to the druggist and say, I need an antibiotic? Is it criminal for you to do it to yourself? I don't know what the laws are in Mexico. Is it wise? Well, do you want to go to a Mexican doctor and have him prescribe it? Or do you just want to look at it and say, clearly I've got an infection and I need something for it? You go to the druggist and then you say, I don't know if this is a gram-positive or a gram-negative bacterium in here, but clearly it's a bacteria. So have you got a broad-spectrum antibiotic that I can take? I probably want a cream and I probably want a pill too. I want maybe 2 different kinds of antibiotics because I want something for here directly and something to go system-wide in case it's spread. Maybe all of you don't know that. But it doesn't take that much reading to get that much information about, bacterial infections. What if it's something more complicated and I need to see a specialist? I can't be a doctor for you. Anyways, getting back to my original point, which I can't remember what the original point is. All I want to tell you is, what about mental illness? There is a spiritual reason for what is going on with any particular person. There is a spiritual reason why they've got a finger infection. It's not easy to tell you what the spiritual reason is, because I don't know. How are you going to find out what the spiritual reason is? You have to let go of your ego. What's that got to do with an infection? Because your ego mind, or your monkey mind, or your human mind, the best humans, we call it the rational mind, but we all know there's idiots that just seem to, God knows, I mean, God looks after drunk people, right? These kind of idiot people, they don't have a rational mind, but, whatever mind you have, once again, I've forgotten what I'm talking about. Mental illness, we're talking about getting involved with psychiatrists, popping pills, and I'll have to think about it and come back to you. In the end, what do I want to tell you? I want to tell you the truth. We're all kind of guessing. And even when I say let go of your ego and that will help you find the spiritual solution, I'm still waiting for some spiritual solutions to come. And I've been letting go of my ego for a very long time. But I don't have any other solutions. Without a doubt, I'm never going to be able to get a really good talk in 15 minutes. So I'm going to leave it at that. And we always do the best we can under trying circumstances.